Afternoon, North Dakota. Thank you for joining us today. Hope everybody had a safe and healthy Labor Day weekend. Looking back to last week, last Thursday, we implemented our county-by-county guidance for the first time during the pandemic with the North Dakota Smart Restart risk levels. If you remember that 5 color codes where the yellow is the moderate. We had been, as a state, all green, which was our low risk. Blue indicates new normal or the lowest risk level. And last week, we moved 8 counties up to the moderate level, meaning increased risk, and 13 counties down to the new normal. I would just say again, these changes took place at 5 p.m. on Friday. Really only 3 days have passed since then. We're not going to be announcing any changes to those risk levels today. I would say, however, if you take a look at this chart and you can see where the risk levels are and where you live, if you're in live in a blue county, but you go shopping or you visit somebody in one of the yellow counties, this would be a time again to really make sure that you're paying attention to our the precautions that we talk about under the North Dakota Smart guidelines in terms of distancing and mask wearing, et cetera, because it only takes one person who might go to a higher risk area, whether they're shopping or whether they might be commuting to work, to bring that back to an event or going on in a blue county and change that, because we know that the way the virus moves around is through human transmission. You can pick it up and transmit it to others. And again, if you're in one of those yellow counties, again, where there is an indication of a higher degree of positivity that's occurring right now, then again, we urge extra precaution for anyone that might be visiting someone in long-term care or someone who's not in long-term care but might be considered a vulnerable adult, just because the risk levels are higher. So when risk levels are higher, then it would make common sense for North Dakotans to take additional precautions than they might if risk levels were lower, and we are at a higher risk level than we had been earlier this summer. When we take a look at next week, when we're going to be reviewing the potential risk levels again, there's some counties that we're keeping an eye on that are in addition to the ones that have already gone from green up to yellow, and those would include the ones that are still listed in green. They're still green here today, but Stutsman and McKinsey and Cass are all counties that have caseloads that are warranting attention, more so in Stutsman, where we have a university. McKinsey's actually fewer cases, but on a percentage of testing, they're in that above 5%. And so these are counties that have more than 20 active cases and positivity rate above 5%, with a small asterisk by Cass, because they've got hundreds of cases, but they're just below the 5% rate, but again, climbing up again. So we want to pay attention closely to those. And so if you're in those counties, while you may be green, they're worth yourself as an individual taking personal responsibility to help make sure your county stays in the green. What we do want to do is we want to decrease transmissible moments, and we want to give the virus less opportunity to spread, and we want to raise awareness and communicate to North Dakotans at these elevated risk levels that there are, simple steps that anybody can do to help reduce the trend. Because if you are avoiding large gatherings and social distancing and you don't have it now, then you're not going to get this virus. If you can't social distance, but you wear masks and others are wearing masks, you're going to greatly reduce the possibility that you might pick up or transmit this virus. And of course, again, washing your hands frequently, always a smart idea at any time, particularly as we start entering into the winter flu season. We are aware that our largest metros and some of these counties are, since the status got changed last week, that they're looking at their own policies, their own strategies. They're aligning with North Dakota Smart Restart, but they want to address the higher concentrations of COVID-19. And of course, they want to do this because they want to protect, they're vulnerable, but they want to protect students, they want to protect their businesses, because they understand at the local level that we're about protecting lives and livelihoods. And that's why we need local leadership to really win this battle. And that local leadership could be at not just at the city level or the county level, elective leaders, but we need leaders at the school board level, the school superintendent level, the church and faith-based leaders. We need business community leaders. Business community leaders have an opportunity if you're in one of these yellow counties where you've got higher risk levels. You don't have to wait to find out if the mayor or the city commission or the county commission is going to do something related to other ordinances or mask mandates, et cetera. You've got an opportunity to say, hey, I care about my employees and I care about my business and I care about my customers, and so we're going to make sure at least even that all of our own team members in your own business are masked up, particularly if you're in a business where you have lots of contacts with population, a lot of face-to-face interaction with customers where maybe your team cannot socially distance. Really smart idea if you want to, keep your business going and stay open and build trust in your customers, is to make sure that your team members, as in your employees, are all masked up. So again, it's going to take local leadership, as we like to say in North Dakota, leadership everywhere. We're looking for that, and whether that's supporting, doing supportive posts for people that are doing the right thing, giving shout outs to businesses that are doing a great job at creating a lower risk environment for people to shop or dine or eat. Again, we want to be supporting those folks. And so again, these locally executed strategies are going to help in the end to slow the spread. And again, we build on all of this. Again, we know that when we talk about the North Dakota SMART guidelines, we recognize that attitudes towards mask wearing vary across the country and they vary across our state. They are, if you just say acknowledge the fact that mask wearing, even in today's environment, can vary by political party, it can vary by geography, whether you're east or west, it can vary by age, it can vary by a lot of things. But I would just say to someone, if you are in a situation where you are, personally adamantly against wearing a mask, then you have an opportunity to do a couple of things. One is socially distance, because if you don't want to wear a mask or can't wear a mask, don't have anybody in your life who's vulnerable or someone that you think might be at risk, then just socially distance. And in North Dakota, we have lots of opportunities to do that. And the second thing we can all do, again, what I talk about is the need in North Dakota for not just increased, but maybe radical empathy, because we really have an opportunity to just stop having a debate about masks. If someone works in healthcare, if someone works in an essential industry, if someone is a special needs school teacher and works every day with students that have special needs, if we have somebody who works in long-term care, if we have someone who works in the military, like last week I had an opportunity to be with Senator Hoeven and Senator Kramer and the Secretary of Energy at our great Minot Air Force Base, where, as people know, it's the only base in the country that has a dual mission with both strategic, as in nuclear bombers and nuclear missiles, and it's one of the areas where we store nuclear weapons in the United States. I can assure you every airman on that air base was wearing a mask, because the work that they do is essential to the security of our country. So whether it's someone, again, who's caring for the elderly, who's wearing a mask, or someone who's in the military that wears a mask, and they may wear those masks when they're on base, and they may be very careful about wearing masks or what they're doing when they're off the base, because they know that they don't want to be the individual that brings COVID back onto a secure military facility. So if you see someone wearing a mask, again, this increased empathy, the radical empathy, is trying to understand that they may have a very, very good reason for wearing that mask, and it may have nothing to do with politics. It may have, and if someone wearing a mask is not at all treading on your individual rights. And so I say, if someone's wearing a mask, they may be an essential worker, and really the only thing to say to them is thank you, because they're doing their part to help slow the spread, and that helps keep every business in North Dakota open. It helps keep all of our schools open. It helps keep our vulnerable population safe. And in the end, I know there's been a number of people that have called out and said, reached out to our office, and they're saying, Governor, why not a statewide mask mandate? And then they point to other states that have done this. We've been saying all along, and this is what I still believe, particularly in our state of North Dakota, where we pride ourselves on our love of freedom and our belief in individual responsibility. And it's said it so many times, it's not about what government says, it's about what people do. When I talk to other governors in other states, including those that have mask mandates, the number one thing they're trying to figure out is, hey, we've got a mandate, but people still aren't wearing enough masks enough. How do we get compliance up? And if you have a state with no mask mandates, like North Dakota, they might say, hey, what are we going to do to help encourage people to have greater understanding and empathy about wearing masks when it's responsible? We have a slide here that shows Minnesota, our neighbor to the east. And again, I want to lead by saying I complete and totally respect every individual state and every governor, because I can't walk in the shoes of any other governor. Every governor's got to understand the situation on the ground in their state and make their decision about what works and what's the best way to help guide their state through this. But we know that you can have mask mandates and cases can go up. You can have mask mandates and cases go down. You can have no mask mandates and cases stay down like we had for much of the summer, and you can have no mask mandates and cases start to rise. And so it is one of the tools in the battle is wearing masks, and that's why we strongly support, encourage people. We have from the beginning as part of the North Dakota SMART guidelines. We've talked about having being understanding of supportive of those people that choose to do it. But again, in the end, it's about individual decisions, not what the government does. And so it'd be great if we could stop having debate about the role of government and start having more of a debate about individual responsibility and have that collective social responsibility start to take hold where people understand that each of us can play a part in helping keep all the businesses in North Dakota open and help getting our students back. I would say that, again, we've had great etiquette in the first few weeks at college. The reports from college students on campuses that are requiring masks is there's high compliance on the colleges. And we're seeing that among K-12, lots of great stories from parents where the kids are, as they often do, rapidly adopt. And of course, hospitals, long-term care, law enforcement, masks are essential. They've been an essential part of healthcare for decades and decades. And again, people in healthcare understand that masks really, truly work in slowing the risk of infection. So we know that there's a big portion of North Dakotans getting up every day, whether those are students or military members that are wearing a mask to protect themselves, their families, and their coworkers. And again, we'd like to just invite others to join this effort with empathy and set expectations, including, again, big shout out today to business owners, again, where I know some business owners might say, hey, I'm concerned about offending customers, that might be freedom-loving customers that don't want to wear masks. I think you can see that the big box retailers, virtually all of them in the country and in North Dakota, have mask mandates in place for their team members. They offer masks when people come in. They've got high compliance and they've got strong revenue. We know that from sales tax. So again, we know that you can operate a business and do this in a way where you don't need a mandate. You just need to encourage people to do their part. And again, we are all in this together. And so let's mask up North Dakota and let's make masks about healthcare and not about politics. Okay, on the next thing we want to talk about is the numbers, and we'll jump into what we're watching this week with 1,873 new cases and close to 1,200 recovered, and sadly 11 deaths over the past week. We are now at 2,264 active confirmed cases. That is down 301 cases from yesterday. And of course, again, I think these, as we know, as all of you that are tracking these closely, people come off the active list when they're cleared through their diagnosis, and again, probably a bit of a lag in the data over the holiday weekend as some healthcare facilities were closed yesterday, but happy to see a record number of people coming off the active list yesterday. First time I think we've had over 300 come off the active list. So down slightly now in confirmed cases, which is a positive thing. On this slide, we've got the 5.4 number, which is one of the numbers that we've reported. This is the 1,873 positive confirmed cases out of the almost 35,000 total tests that occurred over the last week, and that brings our week 7-day run rate to 5.4%. And again, we want that number to get below 5 again if we can. This is a number that's tracking in our minds again the wrong way. We'd love to have that come down. The rolling average, if we go to the next slide, the 14-day versus the 7-day, the rolling average has also been increasing over the past couple of weeks. It's just a sort of flat today, but it's 5.45% on the rolling 14-day, and this is the first day since August 16th that the rolling average has decreased compared to the previous day. So the first time in about 3 weeks. So happy to see that. Hopefully that's the beginning of a trend if possible. But again, way too early to tell on that. But again, we'd like to get that back down under 5. On COVID patients currently hospitalized, very positive news here. We're at 63 cases. Some that may have tracked these numbers before know that at earlier times we had reported at one time a high of 70, at one time a high of 68. Those numbers don't show up here. This is directly off of our dashboard that's available to the public. But as we reconcile the data going back several days at a time when they get a chance to get the updates from the hospital on when people were actually checked out of the hospital, and then some of these numbers end up going down because there was discharges from hospitals that weren't included in the prior numbers. But at 63, we're right in this sort of this range that we've been in for several weeks. Of those 63, 19 of those are in ICU, and in both cases, this means we've got lots of hospital capacity for the state of North Dakota. When we take a look at, well, before we take a look at the next slide, I do want to talk again about the 11 deaths in the past 7 days, but 6 of those occurred since last Thursday's press conference. So we do want to share that there was a man in his 90s in Burleigh County, a man in his 90s in Grand Forks County, a woman in her 80s in Rolette County, a man in his 70s in Ward County, a man in his 70s in Sioux County. Those 5 who all passed away had underlying health conditions, and a man in his 90s from Burleigh County who had no underlying health conditions. And as always, these 6 deaths since last Thursday's press conference, again, are from the First Lady and myself. Our hearts go out to the family and friends who've lost any loved ones during this pandemic. In terms of active cases, the statewide, again, we've shown this slide. This is updated through 11 o'clock today. Out of 53 counties, 49 currently have at least one active COVID case on this heat map, if you will. The darker the county, the higher the numerator, which is, again, just the number of cases. Burleigh County leads the state with 405 active cases. If you include the metro area with Morton County, 134 in Morton County, 539 active cases in Burleigh Morton. We're pleased that we've got this hardworking task force that's working in Burleigh Morton, but we have more work that we need to do here in these 2 counties. And other counties with high active case counts include Grand Forks with 383, Cass County with 374, Stark County up to 188, Stutzman County 154, Williams County 128, and Ward County 111. One thing that all of these counties have in common, as you can easily see, is that these also represent the largest population centers in our state. All of these counties also are home to at least one university. They're all home to regional shopping, and they're all home to a number of long-term care facilities, because the long-term care facilities tend to locate where they've got greater access to staffing, and that tends to be in our metro areas. And as we fight to keep this what is a deadly disease for those that might be in congregate living, such as long-term care, assisted living, or skilled nursing, then again, those where we've seen cases at the vulnerable population, they tend to reflect what's going on in the county, because that's where the staff is living and working. So again, I want to remind folks that if you're in one of these counties with a higher case count, any action you do to help protect you and your family through transmission could be helping to protect healthcare workers who are taking care of our most vulnerable. The active case rate varies quite a bit. Again, this is another form of a heat map, but this shows the rate of prevalence by population across. Again, we've got the 4 counties shown in white that have no cases, but as you can see here, again, because of the population variance, Cass County, with our largest population county in the state, with a rate that is below 20 cases per 10,000, is really like a third of what's going on out in Stark County, home to Dickinson. And again, even in Stutzman County, very high rate there. And so again, we take a look at both the numerator, the number of cases. When we divide by population, we can see a story here where we can see where the spread relative to population may be occurring. The next topic has to do with testing. And we did have a couple of low testing days over the Labor Day holiday weekend. On Sunday and Monday, we had some of our lowest days. I think this was to be expected because we held up on some testing in long-term care at universities and other places over the holiday weekend, even local public health. So there was less testing. We do know and have had throughout this a lag in testing over the weekend. I have challenged our team today as we head into next weekend and the weekends going forward that are not holiday weekends, that while we do see a dip on weekends, we are going to try to implement some strategies to get higher testing over the weekends. And so again, whether those are organizations, tribes, localities, that are interested in doing larger scale testing on weekends, we've got available capacity. We can partner with you. And so again, please reach out to the North Dakota Department of Health or to the Adjutant General Dorman, and we can work to arrange to get more testing. Because again, when we've got days where we do less testing, I sort of liken that to having seats empty on a commercial airline, that after it takes off, you can't sell that seat any longer. And so what we need to do is make sure that we're using that capacity to help identify and slow the spread. And so again, looking for partners that want to test on weekends. We've talked about before that North Dakota has a robust approach to testing, and one of the reasons why we have this robust approach is that we can identify, isolate, and slow the spread. We've been very proactive and we've been very targeting, because when we know from 6 months of this that if you're waiting for to watch hospitalization rates, that you're looking at a lagging an indicator, because hospitalizations and deaths are after you've already got widespread community spread. So that's why we've been testing proactively in long-term care, in our corrections facilities, on our college campuses, places where we've seen outbreaks in other states. But as we've continued to lead on this testing, as we have, and we'll take a look at a couple of slides here about this, where North Dakota had strong testing. When we take a look at testing per 100,000 residents, North Dakota is the second highest rate of testing in the nation. And if we take a look at that on another slide, which shows the lead that we have over virtually every other state except New York, is that this is all completely and totally factual. This is off CDC and off North Dakota data, that these are all PCR tests, which is the gold standard of reporting. And so we're a state of only 762,000 people, but we've completed 508,000 PCR tests, or those the tests where we collect the sample and do them in the lab. Over 212,000 individual North Dakotans have been tested, and to get to over 500,000 tests, that means that many have been tested more than once, which makes sense if you're in long-term care or working in healthcare. And again, we do this to protect the most vulnerable, and it's been very successful. And we are the 4th lowest in the nation in terms of the fatality rate. And we're making an invisible enemy visible through all of this work. And again, as we've said before, every time you're tested for COVID-19, there's a chance your test will be positive. If you've got tested a month ago and you get tested again, your susceptibility is still the same, and the virus, spreads easily, and you could get it after you get a negative test. So each test is important. And the importance of repeat tests, however, has gotten lost in the way some national organizations calculate North Dakota's positive test rate. Here in North Dakota, we're following the CDC's methodology, which puts our positive test rate in line with the national average. But that rate has continued to rise, and that's why we need everyone to do their part. But we know this last weekend, there's been a lot of buzz on social media. There have been reports in some of the local media where North Dakota has been the subject of national focus, where they're doing state-by-state comparisons, focusing on our active rates per capita, our positivity rate, or even the fact that North Dakota has been listing as a state that lacked robust testing. As you've seen on the 2 slides, North Dakota is number 2 and clearly number 2 in the strong testing, leading the nation in our testing strategies. So why would you end up with a bunch of national reports that showed us otherwise? Well, in digging into this with our team, we found that many of these national reports were pulling their data from a group, that was a volunteer organization called the COVID Tracking Project. COVID Tracking Project was founded by some folks that left or still work at Atlantic Magazine. This is not a government organization, it's a volunteer organization, and I understand exactly their motives when they created themselves back 5 or 6 months ago, was that there wasn't a good repository for data from one single source. Other news outlets, including the New York Times and AP, have pulled data from the COVID Tracking Project. Johns Hopkins pulls their data from the COVID Tracking Project, and then other sites such as COVID Act Now and the COVID Exit Strategy also have pulled data from the COVID Tracking Project. Inexplicably, like over the weekend, COVID Act Now, and maybe on their website right now, is actually showing North Dakota's positivity rate at almost 4 times higher than it is presently, and there's not any possible way that we've been able to conclude how they're coming to that conclusion. But we had a great conversation between our team this afternoon with the COVID Tracking Project team, and to help them gain a better understanding of our numbers and help in their taking steps to rectify and to improve the reporting on their sites, which will then change North Dakota's status dramatically. So this is a heads up. In a bunch of these national reports will have turned out to be incorrect. When it comes down basically to definitions, COVID Tracking Project was doing something to count their total PCR tests as test encounters, in which a test encounter was each individual who was tested on each individual day. Now, we understand that they were trying to solve a problem when they came up with this, because if someone had a rapid 15-minute test, it came back positive. Sometimes there was recommendations that someone also go get a PCR test. If that PCR test came back and was concluded the same day, then that was counted just as one test. That's a completely different thing and may affect dozens of tests in North Dakota, the dozens of people who may have had 2 tests and 2 results in the same time, but we're talking about a handful, not about the difference. On the slide I'm showing right here, these national testing sites we're using as the denominator for number of tests completed in North Dakota, the 212,000, which was unique individuals, versus the 508,000, which is the actual total tests that we have conducted. So when we update those sites, the total tests conducted will be very close, within a few, we expect, of the total test encounters. And when you take our denominator and move it up by 2.5, you're going to see, and the numerator we think was accurate in most cases, but by getting the denominator to reflect the amount of testing we've done, that will dramatically change a number of those reports. And so again, this is something I want to give everyone a heads up on, because it will at least stop some of the spread of misinformation on social media, where people were citing these national non-governmental data collection sites as the authority. And so again, we encourage people to get information from health.nd.gov, get information from the CDC. These are places where we do know and can verify that the data is accurate. We will also be adding the test encounters to our dashboard and make it clear that we're in sync with the COVID tracking project, and that they can pull that data and we can be in sync with them. I do want to say again that there have been hundreds and hundreds of people working tirelessly to drive this robust testing strategy, whether it's the North Dakota Department of Health and their leadership, whether it's the North Dakota National Guard, where we've got over 300 soldiers called out helping on this, the local public health units, the private healthcare organizations in our state and their own labs, and again, the folks that are working the shifts, 7 by 24, 3 shifts a day, are doing just really critical work, and they're doing work that's should be recognized positively at the national level. And we want to make sure that their work is important to all of us, because it's helping slow the spread, as I said, making an invisible enemy visible, and their work should never be diminished, and it should be reflected in any national conversations about North Dakota's status in this pandemic. So I want to thank all of those folks, including Governor's Office team and Department of Health and leadership, that worked tirelessly throughout this weekend to work to try to clarify and reach out to and connect with organizations that were incorrectly reporting data around North Dakota. As a final note on testing, continues on our campuses. We've now tested over 12,224 students on our state's public and private campuses. 832 of those were positive, for a 6.8 percent rate, and static testing is planned to continue at campuses throughout this month and beyond. Next topic is the behavioral health update, which we do every single time. And this is, September is National Suicide Prevention Month. I'll be signing soon a proclamation to declare Suicide Prevention Month in North Dakota. It's truly sad to say that suicide is the 10th leading cause of death in the United States. It's the 2nd leading cause nationally among individuals between ages 15 and 34. So this it is a behavioral mental health disease that is even more deadly for young people. According to the Centers for Disease Control, over 47,000 people die by suicide in the United States each year. That's we've got it. Unfortunately, a very high number of people die in traffic accidents in the United States, traffic-related accidents, but this number is even higher than that. Suicide is the only leading cause of death in the United States that's increased every year for the past decade. We've made progress on all kinds of other diseases. We've made progress on traffic deaths, but suicide, again, going the wrong way. In 2019, as it was nationally, suicide was the second leading cause of death among North Dakotans aged 10 to 34. And in 2019, so just last year, 134 North Dakotans died by suicide, and again, which was more than the traffic deaths in North Dakota, more than the overdose deaths in North Dakota, and there was a reported 1,194 suicide attempts in North Dakota. Over 90% of the people who die by suicide have a diagnosable and treatable mental health condition, although it is often a condition that is not recognized or treated. So if you know someone who is struggling emotionally or having a hard time, you can be the difference in getting them the help they need. And you can call 1-800-273-TALK to speak with someone. You can do that 7/24. And if you're worried about someone else, go ahead and call that number, and they can help you learn more about the warning signs and what to say and how to interact with someone that you think may be at risk. Also, if you don't want to call, you can go to the behavioralhealth.nd.gov/prevention/suicide to learn more. And it's a preventable public health problem, and suicide prevention is a priority. And again, together we can continue to implement effective prevention, intervention, recovery, and services so that North Dakotans can find help, hope, and recovery. So again, thanks to our behavioral health team, and again, encourage anyone during these times of challenge, whether it's financial or stress that parents or teenagers, anybody might be having, again, make sure you know the signs and give our behavioral health team a call. Next topic is gratitude, and want to give a shout out as we get back into school. We want to again say thank you to all the teachers that are back in the classroom teaching in person, those that are working hard to do the distance learning. But we know that North Dakota is home to a lot of superheroes, and we all can do the work to stop and slow the spread. But we want to give a shout out in representing to all of those close to 15,000 professionals that work as staff, teachers, or administration in our K-12 system. We're giving a shout out to Karen Arnold, who's a second grade teacher at Liberty Elementary right here in Bismarck, reminding us that like superheroes, we can all save lives while wearing masks. Mrs. Arnold revealed her identity as a superhero in a video that she created for her students to help dispel fears they might have about masks and share some helpful tips. Among the advice that she shared in her video is wearing your mask properly over your mouth and your nose, making sure to distance from others when you're not, and storing your mask safely when not wearing it. And as students continue to settle in the new year, there are many things that will be new and different to them. And I want to say thanks to all the teachers who are casting a fun and exciting light on wearing masks, protecting our students and our teachers, helping to keep our schools open, helping to protect your parents, your grandparents. We thank you all, the students and teachers alike. And again, we all can be like students and the adults. We can all be superheroes, wearing masks and saving lives. And if you're interested in seeing Mrs. Arnold's video or sharing it with your children or your students, the video can be found on the Bismarck Liberty Elementary School Facebook page. So thank you, Mrs. Arnold, for that video, and thank you to all teachers and students. In our gratitude section today, we want to talk about first responders, but this is also a week that we look back. If you're an adult, you certainly remember that coming up this week is the 19th anniversary of as Americans looked on in shock and horror in the aftermath of the terror attacks on the morning of September 11th, 2001. We'll always remember the tragedy of 9/11, but we'll also remember the heroism of those who selflessly risked their lives to save others. In the spirit of sacrifice demonstrated on that day endures today in our firefighters, our first responders, the police and military members who continue to serve in the need and protect our nation daily. In the midst of a national tragedy, time and again, our first responders stand as the best among us. And whether it's the tragedy of 9/11 or the ongoing fight of COVID-19, our first responders continue to serve on the front lines with passion and dedication, and at times with great personal sacrifice. So today, we share our gratitude for those brave men and women who run towards danger when others might be running away, and those driven by the need and the desire to help others and help save lives. So again, again, thank you to all of our first responders as we reflect back with gratitude for all of you on this 19th anniversary this week of 9/11. Closing with a gratitude quote, the philosopher and genius Albert Schweitzer said, "At times, our own light goes out and is rekindled by a spark from another person. Each of us has cause to think with deep gratitude of those who have lighted the flame within us." And if your life has been touched or helped by a first responder, and they literally, whether they helped save your life or affected someone in your family, came to you during a time of need, or someone who's been taking care of you during the time of COVID, this would be a great time to reach out to those first responders in your community or your family and share your gratitude for those individuals who they might have saved a life and rekindled the flame within them. So that concludes our formal presentation. We plan to be back here next Monday at 3:30 p.m. And until then, thank you for tuning in, and continue to remember to be North Dakota Smart and stay healthy, stay connected, and follow the North Dakota Smart guidelines. Okay, we're going first to Jeremy.
Governor, last week, State Field Medical Officer Dr. Joan Connell said in a meeting of the Burley-Morton COVID task force that mask mandates are proven to work where they've been implemented in slowing the spread of the virus and encouraging compliance to wear masks. She also noted that some pretty notable instances in which adults are not being personally responsible in wearing their masks. Is there any point where you would say, you know, our strategy of relying on personal responsibility is not working here?
Well, I think we said all the tools are always going to be on the table, and I know that we've seen in some of the southern states where they took specific action about mask mandates and closing, particularly those places where people were congregating, young people. I don't want to say, I guess the colloquial term would be college bars, but places where you have high congregation of people that can't sit down and have distancing, but you're more shoulder to shoulder crowding around a stand-up bar. When they closed, kept businesses open but closed those places and had the mask mandate, they did show signs of turning that down. And again, I think that we've got across the state of North Dakota, we've only got 13 universities. They're in 12 different communities. I think, again, there's an opportunity here for business owners and community leaders and local task force to try to identify those spots. But I think we can't say that for sure, because in some cases with our contact tracing, it may be a wedding or a funeral that's caused a spread. And we also know that if you, in a college town, close places where the college students may be gathering legally above 21, and you close those down, then you're probably going to end up with more house parties. And you end up with more house parties. I think there was one reported in Fargo near the NSU campus, and not only was, it turned out as a noise call, you end up with 15 people that are underage drinking. I mean, I think that's what probably happens every fall when college comes back together. But it's also just a reality that I think the business owners that are running these establishments, they have a real vested interest in making sure that their employees and their business can keep going. And so they've got a vested interest in trying to figure out a way to make this work. Whereas if they get closed, then I think it's a free for all of house parties with people that don't have a vested interest in their business. And for sure, then you've affected the ability of those businesses to stay open. But again, whether it's a church, a wedding, an event center, it's not all about bars. Again, in the end of the day, places where mask mandates have gone in, they've found them to be very difficult to, the enforceability is very challenging, particularly when you're talking about just a single individual. So again, we're still on a path here where we've got among the we've had a great track record so far, relying on individual responsibility, and I guess I'm still in my heart of hearts hoping that North Dakota can step up and figure out a way to get it done with local leadership everywhere, and local execution. Because and maybe in some other states they might work. I know that in North Dakota, there doesn't matter what we do or what we say, there are people that will not wear a mask, and we all know this. And we might as well acknowledge this, and then again try to figure out a way to navigate through this when some people have it in their mind that this is an affront on their freedom, and so then we are where we are. So North Dakotans, we're going to have to figure out a way to navigate through this.
Do you think that mandating masks would increase compliance?
I'm not sure. I think it could actually, in our state, could create more divisiveness, and you might have even more of a divide, which is people might have done something if it's their choice and they're volunteering and they're doing it for their family, they're doing it for their school, they're doing it so they can keep their football team on the field. I mean, there's a lot of reasons why people, when you have it, we're in it together is not just a slogan. We are in it together. This virus moves through us collectively, and so people that choose to wear a mask have maybe good reasons. That's why, again, I'm calling, I guess, for the radical empathy. When I say radical, it might be radical for some folks to actually try to put themselves in other people's shoes and say, yep, well, I do not want to wear a mask. I don't believe in masks. I understand that other people do, and if I'm someone who believes in liberty and freedom, I should respect that somebody else has the liberty and freedom to wear a mask, just like I have the liberty and freedom to not wear one. So again, respect and empathy. I think we need more of that in our state, and maybe less government. Again, we want the light touch of government, and we want to have a stronger, I guess, consciousness of people understanding how their actions impact others. That's what I think would be great. I mean, we could solve this in a hurry. Jacob?
Governor, your state CEO recently said in reference to the threat level for some counties that some counties could have belonged in the orange area on the threat level, but because it was the first week, they were only moved up to moderate, just one bump up on the 1 week. Wondering if you could corroborate what your state CEO said and give us some insight into why that decision was made the way it was.
I just want to make sure you're hearing. Yeah, but COO, Chief Operating Officer. Yes, that's in fact true, and we, on one level it is, but on the other, we said we're not doing this mechanically. You don't put numbers in a formula and spit out an answer, and so we took a look at a couple of cases where that may have happened, but they were in lower population counties as well, and so we just said, hey, we want to make sure that we're doing enough testing in those counties, and we want to make sure that just as a guideline, I think when we're trying to step up risk levels, when we were going from all green, I think it's fair to the businesses, fair to the everybody there to say, hey, look, we're moving people one step at a time. You can keep moving up. I mean, last stop may not be yellow if the numbers and the what we see on the ground are going the wrong way, then people could continue to move up. But as we were moving to that, we thought the right place to start, whether you're going down or whether you're going up, just as a practice, we put in and said, look, let's just move them one step at a time. I mean, this is a stair step, not falling off a cliff.
If I may, just a quick follow-up on that. If the threat levels don't have any mandatory policy changes in place, what is the concern about moving them 2 levels up if they qualify to belong there?
I think, again, when we talk about what it is we're trying to do with these, is we're trying to raise awareness and we're trying to communicate. We are trying to change behavior, and I think we know that change is hard. And again, I think incremental change is often more successful. So we're trying to achieve the best outcomes we can, while being transparent about, very transparent about where we see the positivity rates and the testing levels and the where we think where we're finding the virus in North Dakota. Okay, we're going to go online.
Sydney Mook with the Grand Forks Herald. Given the recent bump up to yellow and the high number of active cases in Grand Forks County, has there been consideration for a specific Grand Forks COVID task force, similar to the Red River Valley Coronavirus Task Force or the Burley Morton Coronavirus Task Force?
I think there would be some consideration, but my sense from talking to, including to talking to the mayor, talking to others at the university in Grand Forks, I feel like that they're up there. They've got the right people talking all to each other. And the other thing that we've got going on in Grand Forks is we've got such a high percentage of the cases in Grand Forks are people that are under age 60 and asymptomatic, and they're doing a great job isolating. I mean, I feel like that they're really on top of it up there in terms of, and we're not at risk relative to hospitalization. So I see the numbers are up, I see the positivity is up, but I feel like the leadership up there that's all working together between the city, the county, the university, K-12, they're all working together great. If they wanted to form their own task force, they certainly could, but I feel like they got a good operating rhythm up there. If we saw, increases happening either in long-term care, we saw increases in hospitalization, if we saw a number of things there, then you might say, hey, we give them a little nudge, but right now I feel like they're in a good spot. Online again.
Renee Jean with the Williston Herald. Is there any threshold where there are so many COVID-19 cases coming that you would need to implement lockdowns again for high contact businesses? And if so, what would that be?
For Jean, I would just say this is the point we're trying to avoid. This is why we, what might seem like an inordinate amount of time talking about, individual responsibility and human behavior, but we don't want to shut down businesses. We want to keep businesses open. We want to get high school sports and college sports and events, and we want to get everything going again in our economy. And the way we do that is slow the spread of this thing. And the way we do that is through people doing smart individual responsibility. If it comes to the point where we have to do that, we know we have the executive authority to do that, but we're trying to avoid that. So again, everybody that cares about having an open economy and kids going to school 5 days a week, everybody that wants those things, everybody that wants the freedom and liberty that we used to have has a role to play in this. And so again, we're going to keep stressing that as we go through this, and we're going to keep, again, working closely with communities, local public health, school districts, long-term care as we do. We got people on the ground every day tracking every positive case we are in the state to try to make sure, because this battle gets fought at the individual business, the individual school, the individual community level. This is where the battle gets fought. And we'd like to, if we have to, like we said with schools, we'd like to, if you have to have an individual student miss from school, that's better than, next thing is shutting down a classroom, next thing might be shutting down a building. We don't want to be shutting down districts, and the same thing for businesses. If a business has an outbreak, they may need to either voluntarily or work with their local public health. They can work that out locally. We don't need to have a mandate for the whole state. We want to keep people open. Particularly, we have a lot of people that are doing a great job in their businesses and in their communities and in their organizations of practicing all the North Dakota SMART guidelines, and they should be able to keep operating through this whole pandemic until we're through it. Dave?
Just a question about contact tracing. Is the effort still as robust as you think it should be?
We've actually tried to dial that up a little bit, because we know when we got into the 15 to 29-year-old, when we started this thing out, the average number of contacts someone might have had might have been like 5 or 6 contacts. You get into people that are showing back on the campus and they have a lot of contacts. It just takes more work. And again, this is very we've been able to automate the back end with systems in terms of how we're recording and sharing, not sharing the data, but how we're recording the data and aggregating it on a blind basis so we can understand, is it community spread, is it travel related, those kinds of things. But it still takes contact tracers who've been trained on the phone, talking to individuals and calling individuals. And so we have added more contact tracers in the last week or so, and have got those, and we could get you the number of people that we've actually got working right now. But we still have more work to do, and I would again encourage North Dakotans to when you get a call from the local public health that says that you're positive, good time to say to them, yeah, hey, I care about my loved ones. I actually love my loved ones. I love the people I've been hanging out with, and I'm going to share who my close contacts were so that we can quickly identify people that have done that. If you were someone who was at a large event like a wedding, again, I think there's a responsibility. If there's a breakout at a wedding or a funeral, then if it's not public health, then the people that organize those events should probably notify everybody who's a guest that, hey, we found out that there was a positive case, you may want to go get checked. So even if you aren't officially, working with contact tracing, you can help slow the spread by doing your own work of notifying people and giving them a heads up that they may come in contact with someone, just by looking out for all the rest of them, that you may be, again, saving a life down the line of someone you don't even know. Jacob?
Governor, for high school age students, the number of COVID cases in the state has doubled in the last 2 weeks. There's about a 30 to 40% increase for school age kids younger than that. With school just a few weeks underway, wondering if your office has been giving any guidance to school districts that are struggling with their COVID numbers.
Well, I would say the guidance that we've been trying to give to the schools is we want to keep working forward to having school 5 days a week. And this morning, there was at the Emergency Commission, there was a $30 million proposal from DPI that was approved this morning at the Emergency Commission. It'll go forward to the budget section. That $30 million will be paid out to each of the schools based on a base level, I think $30,000 per district, and then about approximately $290 per student would go out on a formula basis for the whole state, explicitly being able to be used for making sure that we have enough staff to keep teaching. Again, whether it's substitute teachers or others that we need to bring in to make sure that if someone is come in close contact and they have to be quarantined or isolated, they're out of the workforce, just to make sure we got enough workforce to keep going to the schools. As Dr. Burke said when she's here, particularly at the younger age levels, if kids that are in the K-5, for example, if they're going to school 2 days a week and then 2 more days a week they're going to childcare, and then the 5th day they're staying with grandma and grandpa, we're creating more transmissible moments than if they were just in their same class, in their cohort, like they were on those days. If we were the same, 15 or 20 kids in the classroom, teachers move, the students don't. Some of the schools are doing a great job, separate entrances. They're reducing these transmissible moments, and I think we want to focus on transmissible moments, not counting the number of days we're either in or out of the building. And so, again, as we gain more understanding about how to slow the spread and balance lives and livelihood, we know that there's very, very little risk for K-12 age students in COVID. And so, again, the vulnerable population, there may be some students with underlying health conditions that we have to be very careful of. There's teachers, but for the vast majority, again, we want to keep driving towards having a 5-day a week school where we can. I talked about K-5. I think we talked about suicide here today, where some of the behavioral health challenges start arising is in junior high aged kids. Those are kids that might be most at risk. They might legally be able to stay at home alone, but they, at the stage of development, could be more at risk than, kids that are 5 and under likely have got a caretaker or babysitter or someone watching them. So it'd be great if we can get all the junior high kids back in school too. Because so many of our, whether it's nutrition mission of the schools, whether it's the behavioral health mission in the schools, whether it's just the socialization versus the isolation, we can do a lot of things to protect our kids by getting them in school as opposed to keeping them out of school. So that's the message. And again, I wouldn't say, I think you used the phrase struggling, Jacob. I would say that there is a number of our schools, for only having been at this a couple weeks, we knew we'd have positives. I think a number of schools are doing a terrific job at developing their protocols when they find a positive, removing those students from contact with others, finding out the close contacts. I mean, I think that they're all, maybe struggle is a fair word, because if you've never done anything before, there's a bit of a struggle, but I just want to say kudos to all the school districts and the administrators that are dealing with this, and I think it'll become more commonplace, unfortunately, and more smooth as they go through, but we're, again, I think the goal here that everybody has is let's keep our students in school. Online, Danny?
Dave Kolpak with the Associated Press in Fargo. In regards to the COVID tracking project, how far off is their claim that North Dakota ranks first in the country in number of cases per capita during the last 2 weeks?
I don't know the answer to that specific, precise question, Dave, but we could get you that. What we do know is that they were counting, 208,000 tests in the denominator versus over 500,000. I do think that you are going to see that I think some accuracy on the reported number of positive cases, because I think that in many cases we know they had the positive cases, right? If we're doing more testing than everybody else, you can't just look at positive tests per capita unless you look at testing per capita. You have to look at both of those things, and then that brings you back to the positivity rate, because positivity rate per capita will vary on whether a state is doing a lot of testing or not very little testing. And in a state like ours where we're doing a lot of testing, particularly when we're doing some of the most robust testing of college students, you're going to see higher positivity rates. But again, they got to look at both things. Look at the rate per thousand of positives and the rate per thousand of the number of tests we're doing. Jeremy?
Governor, I'm wondering, have you heard any reports of people not isolating after receiving a positive test and being contacted by contact tracers?
I personally have not, but given the thousands of people that have been reported positive, I'm sure it's happened. I mean, we're talking about human behavior here, so it's and it could be for a variety of reasons. I mean, you might have someone with very low income that says, look, I get they're telling me to isolate, but I've just got to go to work. I can't pay my bills. I mean, people may feel like that. I mean, they may feel like, hey, I work outdoors, I work in a thing, I can socially distance when I go to work, and they told me to stay home, but I'm not staying home. You could have somebody in a rural area of our state that harvest is on and they're positive and they're like, hey, I'm not around anybody. But you could also have college kids. Again, we're trying to get college kids into the either COVID dorms or COVID motels, and have them stay there. But if someone is feeling perfectly fine and is asymptomatic, which means you don't have symptoms, I get that it would be difficult to say, hey, I'm just going to stay in one spot and avoid people for the remainder of my quarantine if I'm feeling great. So this is the challenge. If everybody had the flu and people are really sick from the flu and they're that age, you stay home in bed and you're like, hey, stay away from me, I'm really sick, or I don't feel like going out, or I don't feel like going to work, or I can't go to work. This is one of the sort of the devious elements of this virus is that people that can spread it feel great, and getting people to comply with quarantine and isolation when they feel great is a really hard problem. I'll bring you back to a phrase. It's not what government says, it's what people do. And so again, those people that are doing the hard work of complying with their isolation quarantine orders that they may have from local public health, you just say to them, thank you, because they're doing their part. They're making a sacrifice, and we appreciate that. Danny?
WZFG and KFYR Radio. As part of her advocacy for a mask mandate, Dr. Connell has been warning about rapidly declining hospital beds. Are we short of hospital beds with only 63 hospitalized statewide today?
Well, we're not short of hospital beds for COVID. There is a strong demand that's occurring in some of our hospitals because last spring we had several months, even though some states actually through executive order stopped things like elective surgery. That never happened in North Dakota. The hospitals were always available to provide those here, but as either by the choice of those organizations or by the choice of the patients. I mean, elective surgery is called elective because it's elective, and a lot of people elected to defer. And so now we got a backlog of, months of, call them, knee surgeries, hip surgeries, I mean, whatever it is that might be elective on an orthopedic standpoint. And we also, I saw that we had a record number of births in North Dakota in some parts of the state. I think there was, I think the Fargo Metro is reporting like over 300. I mean, that requires hospitalization. So there's been demand for positive reasons like a higher birth rate. There's higher demand for hospitalization because of the deferred electives, but when you're talking about thousands of hospital beds in North Dakota and only 63 of them being used for COVID, COVID is not what's creating the pressure on the use of hospital beds. Okay, Danny, keep going on online again.
Blake Nicholson with the Bismarck Tribune. Could you please briefly detail the new Bank of North Dakota business aid approved by the Emergency Commission Day and forwarded to the budget section?
Yes, today at the Emergency Commission, there was also a program that was approved at the Emergency Commission. It'll go to the budget section for further review. Early on in the pandemic, there was of the coronavirus relief funds, or the CRF funds, that were granted to each state by the federal government. Those could be used for those that were economically impaired during the COVID crisis, or it could be used for public health related activities. It had to be things that were used for things that weren't in the budget before March 1st, that had to be expended and utilized by December 31st of this year. And with that, as we've been working through those requests, as you know, the largest chunk of that, $410 million, went to replenish our unemployment insurance fund. So that was, direct relief for individuals who were affected by the economic collapse related to COVID or due to COVID closures directly. And at the time, the second biggest chunk of dollars that went out was $200 million earlier this year towards the Bank of North Dakota to be used for programs which are familiar to many, which often called the PACE programs, which was an acronym which related to the buy down of interest rates on new loans. As the bank found out in the business community, there was strong demand for things like the federal programs, the PPP loans, the payroll protection program. In North Dakota, we had over 18,000 businesses that applied for and received almost $1.8 billion of grants to help them cover payroll during the time of the pandemic, but there was almost no demand or very limited demand for people to take out extra borrowing. And so the $200 million that was approved for the Bank of North Dakota remained there. So today, as part of that, the bank is turning back $120 million of the $200 million is being turned back, if you will, to the Emergency Commission for us to think about how we might allocate that going forward in the remaining 4 months of the year. I mean, September through December, but realistically, we need to probably allocate it the next 2 months if it's got to be spent before the end. So $120 million coming back. They had then downsized their request to $50 million for a program that would not buy down interest on new loans, but it would buy down interest on existing loans. We expect that, like the ERG grants, there's going to be strong demand. This will be likely oversubscribed, if you will, but after approval, whether through the NDIC, which acts as the board of the bank, and budget section, this would be for businesses to buy down interest related to their impaired activity between March 1st and October 1st. The window for application will likely be October 1st through October 31st. After October 31st, all the applications will be reviewed at one single time, so it won't be a first come, first serve. It'll be a ranking criteria that the bank will release in terms of how they'll evaluate who applies for which grants. There was discussion today in terms of program details that it would be limited to $50,000 per business in terms of the amount of money that would go towards buying down their interest. And of course, this would be all administered through your local banking relationship. So it doesn't require a business to have a direct relationship with the Bank of North Dakota. It would require that they be a North Dakota business doing banking with a North Dakota bank, and we would then be in a position to help them buy down that interest. So that's the rough outlines of where it stands today. I'm sure it'll have some additional modification as it winds its way through the process. Today was just the first step of that. But again, key news, $120 million being turned back from prior programs, and 50 of the remaining $80 million that remained with the bank being redirected towards a interest buy down for existing versus new loans. Okay, Danny?
Mike Smith, 660 KUYZ in Williston. Has there been any thoughts on plans for more drive-up testing events in rural northwest North Dakota, such as McKenzie, Burke, Divide, and Montreal counties?
That topic was a discussion a couple of hours ago, and particularly as it relates to how we're going to increase testing on weekends. I think we might see version 2.0 of drive-up or drive-through testing coming soon to a community near you, because we did have, when we were running those, we were getting high participation. They required a lot of work by our National Guard and others to set up a mobile testing site. We tried to move, and we did move successfully to get some static or physical location sets up at lots of points around the place where if people need a test, they can get a test. But I think we're going to see you'll see a testing strategy that emerges around those counties that are in the yellow, and those counties that we're keeping an eye on that have a above 5% positivity rate. Those are obvious places where we need to make sure that we're doing a really robust job of testing, and that anybody that in those areas that has got some concerns or feels they need a test, we want to make sure they can get a test. So I'll just take that question as affirmation that of a need that needs to occur, and I think call it a good question and a good suggestion. More questions online. We're happy that online connection is working today.
Michelle Griffith with the Forum of Fargo-Moorhead. Why will the state not release to the public the number of positive cases in which an individual contracted COVID from a K-12 public school? UND and NDSU update websites daily that document cases on their campuses. Why shouldn't K-12 public schools have something similar?
So thanks for the question, Michelle. This all goes back to individual data privacy. There are two sets of rules. One, of course, is the Health Information Privacy Act, or HIPAA. There's also another set of rules that apply to minors. Most K-12 are 18 or under. They've got different privacy requirements than those that would be college age, assuming most college students are considered adults and over 18. So that's one. And then also we've got the issue that at least at NDSU and UND, which were referenced, we've got large enough student populations where if we're releasing positives, we're probably not the denominator of number of people tested, the number of people that are positive. We're not at risk of, if you have a large enough data set, you can be more public with the data because you're not at risk of someone having identifiable information. But if we've got a public school that's only got a couple hundred students, which we've got many of those in the public, we have many school districts in the state that have less than 300 students. So then you're down to 20 plus per grade, 25 in a grade. If you're in that spot and we start releasing, here are the positives in that school, they may be viewed as personal identifiers. So again, we're trying to find the balance between the highest amount of transparency to allow school districts to take actionable information and protecting the data and health information of those students who are minors. We do have an individual at each school district that has signed a non-disclosure agreement to get information from the state health department. So we've got a way to channel private information to a school district so that on a non-name identified basis, they could still take appropriate action. So we're trying to do that, but the threshold of then releasing it to the public is a path. We have not found that path forward yet. But our goal is always, trying to find the perfect or the best balance between personal privacy and the law and transparency. And we're also trying to make sure that we've got actionable data to school leaders who can take the right steps. But it's a pressing question around the entire country, I'm sure. Thank you for that question, Michelle. Going once, going twice. Nobody else online? Okay, again, want to thank you all for being here today, and again, thank you for particularly for the media that's here, for all the work you're doing to try to make sure we get the facts out, in particular coming off a weekend where we had a lot of erroneous national reports and comparisons. We appreciate your working as we get the updated data on the national sites. In the meantime, again, if you want to get the facts, ndhealth.gov or the CDC, two great places to get information about COVID. So again, thank you all for tuning in. Thanks for doing your part. Thanks for providing your leadership everywhere to help North Dakota save lives and livelihoods. See you next Monday.